is becoming muscular like the boys, and her enlarged clitoris is growing even larger. Jenny is diagnosed with a form of male pseudohermaphrodism that is caused by a deficiency of 5A reductase. Now, over here, what we see is basically a genotypic male that developed in a phenotypic female. As you've seen before, any form of abnormality in the androgenic receptors is going to lead to a phenotypic female. Although before we had mainly, in general, the lack of androgenic receptors, not only in testosterone, but also in dihydrotestosterone, we have a much more expansive damage, let's say, to the reproductive system. Over here, we have a damage that relates mainly to the enzyme that converts testosterone to dihydrotestosterone. Although testosterone receptors are present, and this is what gives us the element of the enlarged clitoris during birth, we do not have, we do have a lack of 5A reductase. Now, so what happened and why pseudohermaphrodism? What happened is basically we have a semi-development of the male reproductive system because of 5A reductase lack. In the previous case, we had a complete lack of male external phenotype because we had a holistic lack of androgenic receptors, both testosterone and dihydrotestosterone. Over here, we have a lack of the enzyme 5A reductase that is going to give me dihydrotestosterone. However, testosterone receptors are present. This is why I have the element of the enlarged clitoris. Now, as you may understand, due to the fact that I have testes and the XY chromosome, eventually I will have, as before, the two very important hormones. Testosterone, which is going to give me the scrotal sac and the differentiation of the Wolffian ducts, and also the anti-Mullerian hormone, which is going to inhibit the female reproductive system, the cervix, the fallopian tubes, and so on. So what happens over here, I have the presence of testosterone all the way to puberty. And what we see is that also during puberty, she does not have enlarged breasts like we've seen before, because testosterone now is being taken up by body tissue. I have the development of the secondary sexual characteristics because of excessive elevation in testosterone levels. And this may be something that doesn't make sense right now. And why it doesn't make sense? Because apparently, although before, during birth, this individual just had an enlarged clitoris with female external genitalia, due to the fact of the elevated levels of testosterone during puberty, I have also kind of a mechanism that bypasses this deficiency of 5A reductase. Now, when we say bypasses, it doesn't necessarily mean that it completely overrides it. Still, the genitalia are going to be small. I have the descent of the scrotal sac at this phase with the elevated levels of testosterone. And also, in addition to this, I have the development of secondary sexual characteristics because of elevated levels of testosterone that resemble those of a man. So the case becomes slightly more complicated than the previous one. Now, Jenny, which apparently now is Jan, it has to decide in which route he wants to follow in his life. He can be either a male or a female. Now, because of the fact that definitely there is not an internal female genital tract, it is much more beneficial, let's say, of course, always depending on the sexual orientation of the person, to continue his life as a man, because there will be the possibility of all the aspects, let's say, that might be going on. And also testosterone defines the libido and the sexual orientation. So during puberty, this individual will know whether or not it identifies as a male or as a female. Any questions? Let's see. Okay, so over here, we do have testosterone, guys, and we do have androgenic receptors. And these androgenic receptors lead to the differentiation of the male, of the development of the male sexual characteristics. However, this development of the sexual characteristics was not complete. This is why we have the enlarged clitoris. Okay, so we have the external lips. However, we also have a clitoris that resembles more like a penis. However, without the urethra, let's say, necessarily. The urethra also could be there. There are variations. Now, remember your PBL case when we were speaking about hypospadias? It is potentially, okay, your case, which was dealing with hypospadias, again, over there, we have a lack of androgenic receptors. Although the case doesn't mention it, in order for that case to be complete, it should have a mention of 5A reductase. In addition to this, the individual that did not have all these elements, maybe it had also underdeveloped sexual characteristics. So the male genitalia could have been small, maybe he had the voice was lighter, or not much facial hair or pubic hair. Nevertheless, the hydrotestosterone is what forms mainly the external genitalia, and because 5 reductase, which is basically the amino acid that is going to convert testosterone to dihydrotestosterone, is not present. This is why I have the female genitalia along with something that looks like a male penis. Potentially, this individual may have the ability to procreate. However, it depends on whether or not the penis has been formed properly. If and maybe there's some surgical intervention that could go on if we're talking about hypospadias. So my answer to your question is that yes, this individual could be able to procreate. However, depending on whether it's on the hormonal therapy that this individual is going to receive, it's either going to look as a male or as a female. So it's up to him if he wants to resemble a female or as a male. And this is going to be defined by the hormone replacement therapy that he's going to receive. Okay, moving on. Now, contrary to males, the female reproductive system develops under no necessary hormone influence. So without the testes being present, we have the Wolffian ducts that they will go into atrophy, and the anti-Mullerian and the Mullerian duct. Excuse me, the Mullerian duct is basically going to give me the female reproductive system. Nevertheless, in the occasion that a genotypic female is exposed to large androgen levels in utero, then I may have a female that it's born as a female, however, again, with an enlargement of the clitoris. So testosterone and estrogen are sometimes two notions that are being confused. So testosterone, yes, is being identified as primarily as a male hormone, and estrogen as a female hormone, but that does not mean that both testosterone and estrogen is not present in the male or the female. In the occasion that we do have an abnormality in the adrenal cortex, then the sexual differentiation or the formation of the external female genitalia may again at this time resemble a male. The reason is because that with a lack of the enzymes by the adrenal cortex, such as 21B hydroxylase, I have again a larger amount of male hormones that are freely available. So they're not being taken up by the tissue. So instead of having, let's say, the cortisol, the enzymes by the adrenal cortex that they're gonna give me cortisol, I end up having more of these two, which are androgenic hormones, that eventually they're gonna affect the phenotype or the external genitalia of the female. So although in this occasion I may have a female that it's of genetically is a female, I may have a female that may appear as a male. Now, this occurs due to a congenital lack of the enzyme 21B hydroxylase by the adrenal cortex. So I do not have the mineralocorticoids that I would like to have, eventually leading to a malformation of the female reproductive system. So we have a fused labia that resembles a small scrotal sac, and I have also an enlarged clitoris like we've seen before. However, this the enlarged clitoris that I have over here is not due to the presence of the male phenotype. However, more testosterone is being produced due to a lack in the pathway of the enzymes. Thus, I have, let's say, more availability of a specific hormone compared to another, eventually leading to a male phenotype to appear. Do you have any questions in regards to this case?
Yes, doctor, we have one question from one of the students.
Yes.
So she's asking, are the male sexual characteristics there but underdeveloped due to deficiency of dihydrotestosterone?
Yes. So they are underdeveloped in the second case that we've seen because of the dihydrotestosterone, yes. And they're underdeveloped also because during birth, this is why we have a phenotypic female, as well as they're underdeveloped during puberty, where I have the enlargement of the penis.
Perfect, thank you, doctor. And I think you touched on this before as well, but another student asked, do you mean testosterone is for differentiation from male to female? Or female to male, sorry?
Excuse me?
One of the students asking, do you mean testosterone is for differentiation from female to male?
Yes, absolutely. So testosterone is, if it's present in utero, it's gonna lead to the differentiation of the Wolffian ducts and the anti-Mullerian hormone that is being secreted by Sertoli cells to to the inhibition of the development of the female reproductive tract.
Okay. Perfect. Thank you, doctor. And one last one. One of the students asking, in the beta-21 hydroxylase deficiency, will the extra androgen levels lead to conversion to testosterone?
Yes. So the fact that there is this deficiency, it gives me an elevated levels of androgens. So whatever you've seen over here, such as in the occasion that we have breasts, because more testosterone is available, thus, and we do not have any target tissue to take up that testosterone, such as in the first case that we've seen, this is why the individual has enlarged breasts. Also, I have a positive feedback going on there. Again, in the occasion also of the adrenal gland, I again have a positive feedback cycle. So let's say the hypothalamus cannot pick up that there are elevated levels of this enzyme, but still it's producing more. This is why it's leading to a male phenotype to appear in the female.
All right. Thank you, doctor. And speaking of Müllerian duct, we have a question on that as well. One of the students was asking a bit into the lecture. She was saying, how does the atrophy of the Müllerian duct lead to the development of the female reproductive tract? Doesn't the Müllerian differentiate into in females?
Yes, the Müllerian duct, it's relating to the female. It is not relating to the male. So if someone has testes, let's say, then the Müllerian duct is not going to give me a female reproductive system. Now, in the occasion of the last case where we do not have the testes, thus we do not have testosterone, which is going to basically give me the scrotal sac, and we do not have the anti-Müllerian hormone, this lady can actually procreate because it has fallopian tubes and a cervical canal. However, it needs to go through a hormone replacement therapy.
Right. Perfect. Thank you, doctor. And last one, if you don't mind. The student asking if he has androgen insensitivity. Who is he going to have testes?
Excuse me?
She's asking if the person has androgen insensitivity, will they have testes?
Yes. So if we're talking about androgen insensitivity, testes will be there. However, there is going to be an androgen insensitivity in the receptors. So although androgens are being released, even let's say testosterone, and to some extent, if 5A reductase is present in the hydrotestosterone is there, the individual, let's say, will still have testes, will not have a female reproductive tract. It's going to have it's going to have a complete female phenotype, so it's going to be born as a female. However, because of the fact that I don't have the receptors, the tissue is never going to grow into a mature male.
Perfect. Thank you so much, doctor. You can continue.
Thank you, guys. Okay. Now, in the last months of fetal life, testosterone induces the descent of the scrotum through the inguinal canal. In the occasion, however, that this inguinal canal does not close properly, such as in the occasion of the first case over here, we have what we call an inguinal hernia, where abdominal viscera are being drawn into the scrotal sac. This can be corrected with surgery. However, it may also have some problems. The individual may have problems in terms of other hormone receptors, androgenic receptors. By the 7th month, testes usually descend in 90% of full-term babies. However, there is the occasion that the testes may not descend. And this is an occasion that, this is a phenomenon that we call cryptorchidism. Now, cryptorchidism can be corrected by administering elevated levels of testosterone later on in life. It could even be done surgically. However, usually by administering non-invasively testosterone, the testes will be able to descend. The problem that exists if this is not corrected is because sperm is being produced in an environment that is much cooler than the core temperature. It is important that they are outside of the internal temperature of the body in order for spermiogenesis to take place. Now, moving on, we have now something quite interesting in regards to me, because puberty is modulated by a lack, or let's say by an inhibition in melatonin levels. And how do we know that melatonin is so important for the initiation of puberty? In individuals that the pineal gland had to be removed, either because of a tumor or something, we see that puberty is initiated much faster compared to other individuals of a younger age. Now, it seems that melatonin has an inhibitory effect on GnRH, and GnRH it's the main hormone that is gonna prompt the anterior pituitary for the release of LH and FSH. So as GnRH becomes pulsatile, particularly at night during puberty, then I have elevated levels of more of LH than FSH. Elevated levels of LH is gonna give me either more estrogen or more testosterone. And this is why during puberty, we have such a big development of the secondary sexual characteristics in both male and female. In females, it's gonna give us the nice curvature, whereas in males, it's gonna lead to a variety of other changes, which, in addition to the position of more muscle, we also have the greater development of the secondary sexual characteristics, particularly in the reproductive system. Now, there is why I put this picture over here of these cute turtles is because in certain animals that are not mammals, the sexual act or the season of sexual activity is defined by the availability of less melatonin. So as the day grows bigger in certain species, so most species, they mate during spring or the summer. And because during that time, melatonin levels are much more suppressed due to the bigger presence of daylight, then the species like turtles or like snakes, fish, or even all sorts of other animals, even mammals, certain mammals, they know that during this period, it's much better to procreate. So much more, greater amount of GnRH is being produced, FSH and LH, thus hormones are present, and also the genetic material is being present for procreation. So as we can see over here, males compared to females are much later bloomers compared to females. This is why during high school you would see females much taller compared to boys. The puberty in males takes place much earlier in life, and maybe usually, males are in general less developed than females, at least at this phase, until they catch up. So females become women much earlier. So they go from the girl to the female mature phase much faster. All these that you see over here in this map are the secondary sexual characteristics that are being developed. Now, as Leydig cells under the influence of LH produce more testosterone, then I have the enlargement of the testes and the accessory sex glands that provide the main bulk of the semen. We have the sexual orientation that is super important to be performed in puberty, and this is why, and this is where sexual libido is being defined. Later on, testosterone is not so important, or the estrogen, for the definition, let's say, of sexual orientation. Once initiated, spermatogenesis occurs for many years compared to females that have a specific reservoir of female genetic material. In men, especially if a man takes care of his health, particularly exercising, it will be able to even procreate at a later phase. However, there is the occasion of an androgen decline, and this mainly relates to the circulation of blood in the testes. Inhibiting blood circulation is going to lead to lower levels of testosterone. And this is what we had in the old ages in the occasion of eunuchs. Now, eunuchs, they were basically boys that were being born in captivity during the Middle Ages or before that. And what was being done is either the scrotal sac was being crushed under hot water, or it was being tied so that the scrotum would atrophize. So as you would imagine, less blood supply would lead to less levels of testosterone. Eventually, these individuals would form as males, so they would be tall as males. However, they would never have the musculature of the male, and also they would never have the developed external genitalia of a male. Thus, they were perfect for guarding the female dorms. Now, when it comes to the secondary sexual characteristics, and particularly under the influence of dihydrotestosterone, we have the male pattern of hair growth, and this is something that is present in some men. We have the deepening of the voice under the influence of testosterone, thick skin, heavy musculature, and all secretions by the sebaceous glands. Another aspect that is present in puberty is the closure of the epiphyseal plates that establishes the final height of each individual. Thus, small amounts of estrogen that are being produced by the adrenal cortex. They produce this enzyme called aromatase along with testosterone, and eventually leading to the closure of the epiphyseal plates and the establishment of the final height. Now, in females, the situation is slightly different. So, under the influence of estrogen, we have the development of breasts, the areolar, as well as specific adipose tissue and certain ducts that later on in life will be important for lactation, and the maturation and maintenance of the female reproductive structures, the uterus, fallopian tubes, cervix, and vagina. Now, during pubertal growth, we all see the female during life, we see a change in the shape of the female. This mainly represents a child, puberty, more or less adult life after birth, and this potentially during menopause. As you see here in the breasts and in the and in the thigh area, elevated levels of estrogen give this 8-type shape on a female. Nevertheless, there are occasions in young women where presence of specific, let's say, abnormalities, such as the polycystic ovary syndrome, leads to an elevated level of androgen, eventually disrupting, let's say, the appealing curvature that is present during puberty and later on in life. And the presence of polycystic ovaries creates a syndrome of, let's say, insulin resistance. Thus, by applying certain medicines such as metformin, it increases insulin sensitivity in the cells. Thus, the reproductive system can get more regulated. The presence of polycystic ovaries not only leads to the excessive androgen release, because estrogen are not, let's say, are not so widely perceived or accumulated by the female tissue. Thus, more androgen are being present, eventually disrupting the deposition of fat in other areas that are not appealing for females.